let's talk about clinical workflows.
Yeah.
I'm a big believer that it's really hard to put in technology if you can't map it out on paper on a whiteboard first.
Yeah.
And that's something I think that you and Penn State have been really good about is
Mhm.
we've had an honest conversation early on in a deployment saying, hey, what do we want to do and how do we want to do it? And if it doesn't work for clinicians, then making it more secure is not going to actually work because they're going to work around it.
Yeah.
So I think you and I together have done that with your CMIO and others. Can you talk about like how you address that internally at your own institution? How do you get stakeholders on board, and how do we work to the best solution possible?
Well, having a good team is obviously the key. Having somebody like Dr. DeFlitch, Krista Flitch, and Mary Angela Walter, and some other team members that John Knapp, and some of the people that I have on my team to help move the envelope has been absolutely pivotal. Knowing that they represent the experience of our teams, boots on the ground, whether it's clinical, from a provider perspective, or staff, being able to say, all right, look, we know this is how we do business. Doesn't mean it's always right. This is how we do business. And once it's clearly mapped out, as you indicated, then going back to having a dialogue to say, all right, first, what's best practice?
Yeah.
What's other organizations doing? Let's try not to, reinvent the wheel, right? Be able to get that under our belt. And if we're deviating from best practice, let's figure out how do we get back to that. And if it's a situation where we are just this outlier, and we have to understand what those risks are and go forward. But there's very few situations that outlier methods work. Because standardization in clinical practice should be standardization, right? So as a physician, I'm not. You're a physician.
Yeah.
I would imagine you're able to perform, medical care wherever it is you are in the state or somewhere else if you do the boards. So that's the kind of same concept we have to do in the technology. Make it standardized, make sure it's mapped out, make sure it's lined up with all of the strategies that we have in an organization that we're taking care of our patients.